Ohio continues to see unprecedented levels of COVID-19 hospitalizations. As of today, 1 in 3 patients in the hospital here has COVID. It's making care hard to come by from the emergency department on up. Our Sarah Shookman talked with one family who experienced it just this week.
This virus is not going away.
This is the hospital surge state health leaders feared.
Essentially the consequence of what we've been talking about for weeks, Sarah.
James Shimp and his mom, Theresa, experienced it this week.
4 o'clock in the morning, she was transported by ambulance to the Akron General Hospital. She was taken off the gurney and put in a wheelchair, and she was put in the waiting room, and she was there for 22 and a half hours.
74-year-old Theresa was having trouble breathing, dealing with severe swelling from congestive heart failure.
To put mom in a wheelchair, I was a little shocked. I thought, well, surely they're going to come see her.
12 hours later, when James was out of work, he joined her, bringing her her first water or meal of the day. James says staff took her vitals but provided no other care until they gave up 22 hours later and went home.
Here's my mom suffering, and there's no doctors on the floor. And I'm like, if you're at the hospital this long and there's no doctors, I understand that you don't have any beds, you don't have any place to take them. I understand, but this is a problem that's been going on for 2 years and you're not prepared.
First, let me emphasize that nobody's being turned away from an emergency department.
Dr. Robert Wiley with Cleveland Clinic said today the bottleneck starts because there is no bed space on hospital floors. So patients being admitted are backed up in the ER while others are treated right there in the waiting room.
That's intentional. It's not by accident that we're moving into the waiting areas and making sure that we touch base with everybody who's there to make sure we can do a rapid assessment and take back the sickest people that we need to take back to and attend to them immediately.
The other issue is staff. More than 1,200 National Guard members are deployed to 40-some Ohio hospitals, including Akron General, to help with staffing. Only 140 of them are on medical teams.
So 75% of the people who are hospitalized for COVID are unvaccinated.
The best news today was that new cases in Cuyahoga County seem to be dropping by 25% in the last 2 weeks, mirroring the ice pick curve of Omicron first seen in South Africa.
We're keeping our fingers crossed that the same decline that they saw in South Africa, that we will see a decline. Maybe not as sharp, but we hope to see a steady decline. And I think we've got the first inkling of that in Northern Ohio right now.
Now, health officials predict hospitalizations could peak sometime later this month. Now, the clinic is also seeing twice as many providers returning to work than those going out with COVID. But they say they still had about 3,000 caregivers out sick as of this morning, Laura. Wow. All right, Sarah, thank you so much.